guys, this is Dr. Hub. Today we look at the classification, and this is going to be for the vascular tumors and the tumor-like conditions. So to start with, we look at the benign neoplasms. Benign neoplasm, the development and the acquired conditions. So first, what we have is a hemangioma. Hemangioma, it contains a capillary as well as the cavernous hemangioma, and then comes the pyogenic granuloma. Next, after pyogenic granuloma, there is the inclusion of the lymphangioma. There is lymphangioma. So what are the components of lymphangioma? It includes a simple capillary lymphangioma, a simple capillary lymphangioma. Next, what is involved is the cavernous lymphangioma. There is a cystic hygroma. Next is this presence of the clonus tumor as well as the vascular ectasis. So what does this involve? This involves the nevus planius. Then comes the spider telangiectasias. That is an arterial spider. Then it also includes the hereditary hemorrhagic telangiectasias, that is Osler, Weber, Rendu disease. Next, there is the reactive vascular proliferation. So reactive vascular proliferation, it includes the bacillary angiomatosis, Then we look at the intermediate grade neoplasms. The intermediate grade neoplasm. So what does this include? This includes a Kaposi sarcoma as well as the hemangioendothelioma. Next is the malignant neoplasms. The malignant neoplasms includes the angiosarcoma as well as the hemangiopericytoma.